Dr. Gobi. Under the family health expenditure, I would talk about prescribing medications. Uh, while prescribing medications to chronic patients like diabetes, high blood pressure, heart disease, or cholesterol, first of all, if it's a mild case or mild to moderate case, we have to look at lifestyle changes. That will help a lot for the patient. Most of the time, lifestyle changes can reduce the amount of medications to be taken. Okay. After that, the lifestyle, if for the first 2-3 months, we can adhere to lifestyle changes and see what's happening to the patient. Once the patient comes for follow-up, shall we say at the third month, we can check and see whether improvements are happening. But if the improvements are not happening, then of course we'll have to prescribe medication. While prescribing medication, we'll have to look at a lot of things like the patient's current medications are very important. Previous medications, allergic reactions, side effects have to be looked into. Also, the patient's age is important, the weight of the patient, also to see what other conditions the patient has. For example, if you are prescribing for high blood pressure, if the patient is having bronchial asthma, you should not prescribe beta blockers. So, like that, there are some medications which should not be given for some of the conditions of the patient. Also, prescribed medication, you have to be appropriate on the medication and the dosage and the frequency and the length of the medications to be given. So it has to be told to the patient too. The advice has to be given to the patient regarding the medication. And also then follow up. The patient has to come for follow up. That is very important too. So the doctor can determine whether he is getting better or not getting better, and what other things have to be done, like changing the medication or reducing the dosage of the medication or dropping some medications. So these things will help to the patient too. So I'll be talking about family physicians in my next video.